Hi, my name is Greg Felt. I'm Director of Public Health for Sheffield. This is a position statement for COVID in Sheffield as of the 16th of November. Firstly, 7-day rates have stabilised and are beginning to come down. That's true for the whole of South Yorkshire. It's definitely true for Sheffield. But they're stabilising and coming down from a much higher rate. You'll recall in summer rates were fairly stable for quite a long time, a rate of about 20 new cases per 100,000 people over a 7-day period. Now they're in the order of 315 per 100,000 people over a 7-day period, coming down. And actually, one of the rate in Sheffield is one of the lowest in Yorkshire and Humber, which is obviously good news, but far too high for complacency. Age-specific rates are also not increasing, or certainly not increasing rapidly anymore. We've seen a stabilisation of the average age of a case, had started to go back up, but that's stabilising. An indication that rates aren't increasing rapidly in the elderly, and what we see is if we look at age-specific rates, then the numbers, the growth is beginning to slow down significantly. There will be a lag between the 7-day incident rate and the hospitalisation and death, and that will come. But certainly we would probably have seen about the peak of the 7-day rates for the elderly and for all other age groups. So rates went up quickly, they're coming down slowly, and they'll continue to come down slowly for quite some considerable time to come. As I say, we're at a very high rate, so there's no room for complacency. We will need to continue to be vigilant for quite some time. We'll need to continue to wash our hands, keep our distance, wear a face covering, limit the number of people we're in contact with for quite some time, because all of those things have made a difference. Our naught is somewhere in the order of 1.1 to 1.3 everywhere, and we're seeing that across the country, but that's probably also certainly the case in Yorkshire. So for a 100 people who have this illness, they will pass that on to between 110 and 130 people. What we want is for R naught to be below 1, so for 100 people to have the illness, they pass it on to less than 100, and that begins to shrink the epidemic really quite quickly. So we'll continue with our current strategy and our current set of interventions for quite some time to come. Hospital activity, it's probably too soon to say that the hospital activity is over the peak. There's a lag between new cases, people being poorly enough to be admitted to hospital and then being admitted to intensive care from a general ward, and then some sadly die. There's a lag in all of those things, but it's probably the case that the growth in hospital activity is flattening. However, it's nowhere near normal. Hospitals remain exceptionally busy compared to this time last year. It's a long way from normal, and that will be the case for some considerable time to come. So that underscores the importance of us all continuing to stick with the programme: wash hands, wear face covering, keep distance, and limit the number of people we have in contact with. But put simply, the more people we have contact with, the more opportunities there are for the virus to spread. So all of those things will contribute to less people being admitted to hospital and less people sadly dying. The last thing I'll say is that we haven't yet seen the peak of deaths. There've been 81 deaths where COVID is mentioned in the death certificate since the 1st of September. That's continuing to rise, and again that reflects the time lag between case onset or symptom onset through to the death in a very small number of people. So I'd continue to ask Sheffield to remain vigilant for some time to come.